Hello my friends, this is Jason with Wound Care. I was just going to do a quick video on how to use the control panel for an Arjo Citadel bed. Control panel here, I get a lot of questions on it about the nurses, and every time I place one of these beds I try to do basically this quick 5-minute or less in service on how to function this bed on some of the properties of it. To start off with is the most obvious, and that's how to turn it on. On and off button is here. Hold it in roughly 3 seconds. It powers up. It will start firming up the mattress to where it'll be ready for a patient and for you to do whatever you need to it. Got an alarm feature here in this line. Position buttons here. There's some special use ones here. This set of buttons here is for weight setting. Instead of having to type in the weight or what a patient is, height and weight, they ask for a very basic criteria when you put the patient in there. And I'm going to zoom in so you can see. Instead of doing a specific weight number, it's weight ranges of 1 to 65, 165 to 250, 250 to 350, 350 to 500. So max capability on this patient is 500 pounds. Then we'll have to go up to a bariatric bed. Also, you'll notice the small person versus the tall person, or short versus tall. That, as you scroll through here, and as you hit the setting button, it will go from top to bottom here and highlight to where you want your setting to be. This is tall, this is short. If the patient's 200 pounds, you'd set it over here in this, and if they're a tall person, you'll set it there. The only thing that button actually really does on that setting is it presets these comfort buttons over here. This is the amount of pressure that the patient is under right now. This is factory recommended settings. However, you have the custom buttons here so you can adjust it. If you have a patient that's particularly digging their heels into the bed or something like that, you can actually soften it or firm it depending on what you need for that patient. You can firm the back section up if you needed to, or you can soften it depending on what the issue is you're having with that particular patient. Over here you have a section of these buttons. These are kind of the most underused buttons that we have. This one here is a favorite of mine. If you have ever had a little short grandma trying to get in and out of the bed and she ain't but 4 foot high, and you're having to go get a stool for her to step up on top of to get her in the bed, or just nearly pick her up. Nah, you don't have to do that, but if you had a patient you have to get a stool for to help them get into the bed, the little sag right there is in the center of the mattress. When you depress that button and it turns green for about 15 minutes, it will completely deflate the center portion of the mattress. Given that it's an air mattress, it does have some padding underneath for emergency power failure, but it will deflate about roughly 4 inches of the mattress itself to help that patient be able to get in and out of the bed. This section right here, you can already tell as I mash on it, that mattress just got a whole lot thinner. The bed height, they say about 4 inches that it'll drop. So it'll help you be able to get a patient in and out of the bed a little quicker and a little easier. We'll turn that one off. That'll go back to normal setting. Next one is the deflate the head of the mattress. That does this very same thing except for up at the headboard. Up at the headboard, this section of the mattress is now deflating. This is something that'll be used very infrequently. We have used it and set it some during COVID times while we were proning patients. That seemed to help. We have also used, you also use it the most commonly nowadays for intubating of patients. As you're having a code or something's going on, you're in the ICU and you're trying to get a patient's head to be able to tilt back far enough to help with the intubation. This button here is my all-time favorite button on these beds, and you can see here it shot up the firmness of the bed. What that is max inflate. This will raise the mattress up to its tightest firmness on the mattress itself. That will allow you to be able to scoot the patient from bed to bed much easier, adjust, pull up on the patient in the bed, position wise. It helps significantly with wound care. If you're trying to do peri-care, daily care, and you're trying to cleanse the bottom after a BM or a bed change, you're able to roll the patient and access more of the patient's skin versus the patient being sunk into the bed. Okay. Next feature, we'll turn that one off. And again, that also makes inflate. People always worry about it being firm for too long, but it has a timer setting on it too. It will also turn off in about 15 minutes, 10-15 minutes, something like that, and return back to its normal therapy settings. This here is your transport button. This transport button, when you depress it, not much actually changes per se, but what you're doing is you're letting the bed know you're going to be unplugged for a little while. So that gives its little computer system a heads up that it may be going into transport, going to imaging, something like that. Procedure is going to be done. It will attempt to hold therapy in this mattress on battery for as long as it can through a slow air release system. And it will try to maintain that. It knows it's being transported with a patient, be unplugged for a while with a patient on top. So we've done this row, we've done this row there. This is a handy set of buttons here. This is your turn assist button. If you hit this button, you have to have transport off. If any of these buttons are lit up, you usually can't toss this button in. Also, I had lowered a side rail for you to look at. One other feature of this bed, I'll lower that so you could look at the seat of the mattress. One other feature of this bed is it is considered integrated between the surface and the bed frame. So the computer in this bed is smart enough to know what position you've put it in. And that's my biggest complaint on these beds, is that in a chess match it would probably beat me or come after me. Anyway, these turn assist buttons, it knew that the side rail had been lowered. It knows in its brain that it would have been a bad idea to incline the bed in the direction of a side rail where a patient might fall out. Okay. This is activating. If you can see there, that is the mattress raising up, not just my hand shaking the screen, but you can see we're being lifted up there. That gives about a 20-degree turn within the mattress itself to help you be able to turn over the patient or turn them to the side. If you have a very large patient that's very difficult to turn, you can use that. I will usually use that feature, and then I'll hit the max inflate, which will turn that feature off and allow it to start going back on its own. Also, you can use this almost like a cheat on your turning. You can raise them up this way. It will shift the weight, gives you an opportunity to put a couple of pillows between them and the surface to give them a good turn. And then if you leave it in this position, that light will automatically time out within about 10 to 20 minutes, I think it is, and it will return back to a flat position, allowing the patient to go back to the side. So it gives them a little bit of a turn, a little 20-minute position change, and then it gently elevates them back. Okay, this here is back to the static position, going back down level with the rest of the bed. This feature here is your massage feature. Whenever I set it, most often I will set the massage feature for times when I can't use the turning feature of this bed. Totally, this bed has 3 therapies. It has your alternating air pressure therapy, it has your massage therapy, and it has the turning therapy. I have had patients, families before complain to me that nurses weren't setting the therapies on the bed because they didn't see it set to turn, they didn't see it set to massage. Thing is, with this bed, it has the default of why we're placing it. is the alternating air feature that it has. In alternating air beds, one portion will be inflated harder and lifting up more than the other side. These are softer, this is firmer, and it will constantly interchange these tubes on which tube is supplying the most weight relief and support of the mattress. By interchanging those slowly with the computer, it increases the blood flow to the patient's backside and other bony prominences, hence really helping to prevent bed sores. That being said, I've had to explain that on occasions to patients' families that just because these two features are not being set doesn't mean the patient's not getting therapy that's recommended and ordered, okay? The alternating air pressure on these beds cannot be turned off. They are always alternating that air. Okay, this feature here is a massage feature. This is designed that these billows will work their way as a massage to the core of the body, coming from the feet up and from the head to the trunk. It is supposed to be able to help with edema. This section over here, when you hit this, it activates that. This is the intensity of the massage, as you can tell by the waves. I have always just went ahead and default set it to the most aggressive or the strongest massage, and I will come over here, and this is 15 minutes, 5 minutes every hour, 10, 15 minutes every hour. I will typically put my patients that I'm worried about with pressure on the most intense to the most time. And I will say I've never had anybody complain about the massage feature. I've just never have. It's never annoyed anybody, never caused any distress to anybody. They generally appreciate it, especially when you promise your patient a massage. This over here, you can only have one of the other of these features going at one time. This is the one spot that gives us the most problem. This is the turning feature. This is automatic turning. You can set it by rotating through these lights by the button. Here's every 2 minutes, 8 minutes, 15 minutes, and every 30 minutes. Hit it one more time, it will turn off the turning feature for you. Same thing over here in the massage. When you scroll through it, hit it one more time and it turns it off. So this is back off again. Why do we have the 8, 2, 8, 15, and 30? These turn beds, a lot of people don't realize the number one marketing reason for these beds is actually not pressure. The turning feature of this bed cannot replace the turning of a good nurse, good CNA family member. The patient still needs to be turned because it's not enough of a turn to get completely off the bony prominences, especially if you have a patient that's extremely stiff or contracted. If they're contracted so much, you've seen those patients where all the weight always stays on one hip or the other. It's turning that 20 degrees, but it might not be enough to remove enough pressure to prevent a bed sore. But does it help? Oh yes, it gives a good angle change and such as that, but it just can't replace the nurse, okay? So here, going up to the 2 minutes and 8 minutes, I typically don't set it for that often on my wound patients. I don't want to make them seasick. Typically, this is used for respiratory patients, and that's the main marketing for these beds now is for pulmonary tolerating. We used this feature a lot when COVID was so bad. This keeps the patient moving, even if they're ventilated and such as that. Their lungs is still shifting side to side to help keep fluid moving and secretions moving so it's able to be expelled better. Okay. So here we have every 2 minutes. That's going to be too often. Every 8 minutes. 15 is typically what I set mine for. And for 30, you can do that as well, depending on their complaints and such. I'll give one other tip. I always like to tuck in pillows on the side rails right underneath the arms. That way, as you can see the angle change, the patient feels like he has a pillow underneath his arm next to the side rails, and the patient kind of feels more control, just to say, and they feel like they're going toward a softer surface. A lot of times it can be alarming to a patient for their whole bed to be changing or a whole environment to be changing like that. And if you have them kind of tucked in with a pillow around them, you can usually cause quite a bit of benefit there and more security felt to the patient. So I highly recommend tossing a pillow underneath each arm on the sides. It will give them a better sense of security when that bed starts to fold them over toward the side rail. Now I'm finally stated to the end. I'm going to show you the number one complaint that I have on these beds. For instance, let's say we came over here, we're checking on the patient, we reach over here, we drop the side rail down, check on the patient, oh, it alarmed. We're going to put the side rail right back up. You can tell here it has straightened out the bed and it's turned off the function. What I always play around with or say with my staff and patients, it seems like we've turned the alarm off. But you'll notice this long pause of silence from the bed. It's still alarming, but it shuts off long enough for you to get out the door. So it is still alarming. You'll hear it here any second. There it went again. So on this console, if you notice, one thing that's changed is these amber buttons here. For me, this drives everybody crazy because there's not enough ice catching signal to that amber color, that yellow color, that gets people's attention to that it's alarming or that's where the issue's at. And I've had nurse after nurse miss what this console is trying to tell you right now, which is to focus here, and there's a silence button right here. Once you hit that silence button, that alarm will shut off. I've had that alarm go off for an entire weekend for 3 days on a patient. And very dissatisfied patient. We do not want this to happen, hence I'm making these videos. That's how you shut the alarm off. That will put the bed back into its standard mode. It will not restart the turning feature until you come over here and hit this button and reset the turning feature to where you want it. The basic thought behind this bed is when it's alarming, it wants somebody to come in here and check the patient. The alarm, when you turn it off, is you're basically telling the bed is, hey, my patient is safe. Okay? That's what the bed's trying to communicate. It knows that a side rail was dropped. It doesn't know if a staff member did it. This will also alarm if the head of the bed is above 30 degrees. I've had patients who hated the turning feature and they would purposely raise the head of the bed up to 31 degrees just to turn off the turning feature, and they didn't mind listening to the bed. And nurses would have to either let it beep or come in here and hit the button. So when you hit that button, the next thing the bed wants is for you to resume your therapy if that's what you wish to do. Push in here once, twice, 3 times. It wants a nurse to come in or a live breathing person to verify the patient's in good shape and we're ready to resume our treatments. Bed's raising back up and you're good to go. This concludes my video for the control panel down here. I'm going to try to do some more to put onto this playlist so the nurses will be able to see shorter videos and turning off that darn alarm and about troubleshooting with the bed as well. Alright, thank you. Please like and subscribe. Thank you.